much. My name is Dr. Emma Obegi. I'm the Acting Director, Medical Services, Kisumu County. So, secondly, we have had cases whereby you have pressure, you've been given medicine. At times, it becomes difficult to take those medicine. Please explain to your healthcare worker that the medicine that you gave me, I'm having a challenge taking them. That way, the health system is able to see which medicine will work for you, and then we'll be able to understand your challenge and you'll be able to have a good pregnancy. And lastly, when it is time to go to the hospital, that you are in labor, or you have seen that your feet are swollen, or you are having difficulty, that you are seeing things that are not very clear, please use our emergency operation center so that you can ask for an ambulance, and the ambulance will go to the nearest facility near you, and you'll be able to be referred to either Jaramogi or Kisumu County Referral Hospital, or Kombewa, or Ahero, or Muhoroni, or Nyakach. These are the facilities that we are building to be our hubs, and they will be able to have all the services that you require during that particular period. Thank you. So, Preeclampsia. Yes, about 25% of the women who present to our health facilities will have a pressure that is higher than normal. So if it's not managed, then it moves into eclampsia, and that is what causes problems. So we are having a case of about 25% of the women in Kisumu who experience preeclampsia. 5 of our sub-counties have a teenage pregnancy rate of above 20%. It is an area that we are working together with other sectors in the county, that is the sector of education, the sector of agriculture. Specifically, I will speak on what the health department is doing, that is working towards looking into how can we engage our young people to ensure that they are able to get the right information. Remember, a pregnancy results from engagement between a girl and a boy, or a man and a woman. So, number one, through collaborating with the youth, gender and sports department, we are able to engage young people in sporting events to give mainly information. Number one is information about abstinence. Number 2, faithfulness. Number 3 is condomization. This is enabling us to ensure that these young people have information. And lastly, as a health department, we have 148 facilities that are open, and these are facilities that are able to offer contraceptive information. First, information for the young people to choose the right method for them, and second, once they have chosen the right method of contraception, then they are able to be given that particular method. Remember, as a county, we are also a high prevalence county for HIV. So when we're speaking about condomization, we are both looking into preventing the new infections for HIV that are very high in the age group of 15 to 24 years old.
I'm the Chief Executive Officer of Access to Medicines Platform, and I'm also the convener of the Meta Kenya CSO Alliance, which is a national alliance represented in 10 counties. Today we are celebrating World Preeclampsia Day here in Kisumu County, a collaborative engagement with the County Department of Health, and a public-facing event where we have undertaken to sensitize the communities on the early signs of preeclampsia, where to get medical attention, and what to do in case they experience some of these symptoms. Preeclampsia is one of the leading causes of maternal mortality in Kenya. The situation in the country is that while we have targets that we have set as a country, we are still way below par in terms of achieving these targets of reducing preventable maternal mortality, which is really mothers dying while they are giving birth. Of course, one of the biggest issues is the lack of capacity to do effective diagnosis of preeclampsia in good time, so that women, girls or pregnant women are able to get the treatment they need The other issue, of course, is the expertise in the lower level facilities. So if women are going to the dispensary and the health center, which is where the majority of them live, it means they might not be able to get the diagnosis they need in good time. So they have to be referred to another facility, which might actually be too late when you listen to some of the adverse symptoms that we have had today from the experts on what preeclampsia can do. Of course, the third one is the issue of commodities. One of the most important commodities in reducing the fatal effects of preeclampsia is magnesium sulfate, and this is commodity that needs to be available across all the facilities in the country, in the lowest level, particularly the level 3 facilities where we have clinicians that are able to administer this drug.